I'm going to be talking about the continuity of care in early childhood settings. So for those of you who don't know, continuity of care is when caregiving teams and teachers follow with their children from about birth through 3 if possible, so in the infant setting all the way until hopefully preschool. And there's just a definition that I put from the Young Children magazine that NACI puts out every month. And I will be talking about some benefits that children and families and the teachers as well have when we practice continuity of care in early childhood settings. So to name a few, it really helps create a partnership between families and teachers and the center as a whole. There's shared leadership with what's going to happen with the child and figuring out their needs and how to help meet the parents' needs as well. So some other benefits for the children, especially is their social and emotional development. It really becomes a big one when the teachers are learning about individual children. It keeps the group sizes for activities very small, which helps the teachers understand each child's development. So they're able to understand the children and their family as well. It creates a less stressful environment for everyone, for the teacher and the child and all the children in the classroom. With the social and emotional development, children are able to improve their self-regulation skills and understand where their emotions are coming from and be able to talk it out with a primary caregiver. So continuity of care is really about having a primary caregiver and someone comfortable interacting with a family and a child and understanding the cues of the child and their needs and what makes them tick and everything like that. It also helps with consistency in the classroom and consistency for the child. It helps have caregiver family partnerships created. So Mary Ainsworth did an experiment called the strange situation classification in children aged 1 to 2 to see how attachments differed between children, comparing different situations with their parents and different situations with strangers and caregivers. And she found out that there are 4 different types of attachment: secure, insecure, ambivalent, resistant, and insecure avoidant, and disorganized. So secure is really what we're striving to get with every child. So the child becomes confident that the attachment figure will really meet their needs and just really understand what they need and how to meet them. With insecure ambivalent, the child is dependent of a particular attachment figure, but doesn't really engage with them in interaction. So they're difficult to be soothed and comforted by that attachment figure, even though they are really dependent on them. They just don't know how to soothe themselves with that person. An insecure avoidant attachment, the child is physically and emotionally independent from the attachment figure, and that's because the attachment figure is very disengaged when the child is under emotional distress and really needs their that primary caregiver to help soothe them and talk them through what they're feeling in that moment. And disorganized attachment shows the disorganized behaviors and interactions towards that attachment figure. The child really doesn't know how to interact and respond with them. So the conclusion of that experiment was that we all want a secure attachment with every child. It's difficult, it takes a lot of work, and sometimes, unfortunately, it just doesn't work, but we just have to keep trying. So we really want that attachment figure who's sensitive and responsive to the children's needs, so they can have secure attachments. It helps build some social skills, self-esteem, understanding their emotions and how to explain them to others, and the children get confidence as well. So a little bit about my journey with continuity of care. I skipped substitute. I never was one, but what we had when I came into the current center I work at is a building resource teacher. So I worked full time, but I was traveling from every classroom, every age group, just as needed. If teachers were out or they needed extra planning time or extra support in the classroom with certain children, or in general. And then, so it kind of felt like I was being pulled at in a million different directions, and I really was not able to create secure attachments with children because I was never there consistently. So I had attachments with them, but it wasn't really leaning towards any of the four. It was just creating an attachment and a bond, and then I was never their primary caregiver. And then I went to a family group teacher position, and now I'm a lead teacher. So I have a family group that I started with when they were in the infant room, and I've been able to travel with them to the toddler room right now. So we've been doing a lot of small group activities together. Their birthdays are all around the same time, so I'll be able to transition them to preschool next summer. So although I won't be able to go with them to preschool, I would have stayed with them from infancy until they're ready for preschool. So we're practicing continuity of care there. And eventually I'm hoping to get into more administrative roles, such as a program director or director, where I can